coming to you live from my car. So I am planning on doing a lot more story times, a lot more sit down videos where I'm just chatting about different topics. And I think a lot of them probably are going to end up being right here in this car. So today I plan to talk about my breastfeeding experience with Eli, and how I ended up getting mastitis, but it ended up resulting in an emergency surgery. So just to kind of give an idea of kind of the timing of like when things happened. So Eli was born February 2019, before the first lockdown, during that crazy thing that they called a pandemic. We'll just leave it at that, so we won't get into too much information on that. But yeah, so it was during that time, okay, 2019. And yeah, obviously Eli is my first baby. And I had him. I always had the intention of breastfeeding him. So as soon as he came out, when he was born, I put him straight onto the boob and he latched, and yeah, we started breastfeeding immediately. Obviously when babies are first born, like, they're on the boob all the time, so that was normal. Everything was going okay. I used to feel after I would feed Eli that my boobs wouldn't be fully empty. So I used to pump kind of sometimes, and I was advised to do so as well by like midwives if I felt as though they weren't fully empty. I had a very, is it called like heavy flow? Like I had a very, basically I had a lot of milk and like Eli would feed from each breast for like a long period of time and then fall asleep, and I would just feel like they weren't fully empty. So, yeah, I wasn't getting any of the kind of call outs from the midwives or the community midwives that you usually get, I think, when you, like, especially as a first time mom. So I wasn't really having anyone like check up to see how the breastfeeding was going, or to like pass questions by, or like run questions by if I had any. So eventually, I think it was about 2.5 months, I started feeling like something wasn't right. Like it was just so painful, and I felt like, I know people say like breastfeeding's painful, but I just felt like this is like excruciating. I didn't know what was going on, and like I had been looking at things online, and I had suspected it could be mastitis. So, yeah, I ended up then starting to get like quite severe symptoms of like fever, really, really like feeling weak, really dizzy, just didn't feel like myself. And part of me was like, okay, maybe it's just because you're adapting to like not having sleep. But my body just felt like it was like the only way I can describe it is like, just like the basic of things were like taking so much energy out of me. I just didn't feel right at all, but I kept with it anyway. I kept on going. And then eventually I went to the doctor because I was like, this isn't right. Like, it feels warm, it feels sore. So I went to the doctor, and he said, yeah, you've got a really bad case of mastitis. He prescribed me antibiotics, which I was hesitant to take, but I took them because I was like, this needs to be fixed. Like, it's so painful. And they were like really engorged as well. So then, and this is like, as I said, 2 months like on, so it's not as if like it was at the kind of first few days where they do get engorged until they kind of like get used to your baby's demand levels of what they need. So like supply and demand, when like that's starting to happen. It wasn't like during that phase, it was when Eli was 2 months old. So go to the doctor, and he prescribes me antibiotics and says just keep emptying it via pump if you feel like you need to. So go back to him. Nothing is changing. It's not getting better. If anything, it's actually getting worse. And I'm like, look, this doesn't feel right. Like, it's so painful. The antibiotics haven't seemed to help. So he then gave me a different antibiotic to try. And if you know me, I am like so hesitant to take any medication. Like, literally my arm will be falling off and I'll be like, no, like I don't want anything, just put it back on. So I was like getting a bit irritated that like his answer each time was just take these antibiotics. But I didn't know what else to do at this stage because, as I said, I did believe I had like an infection. I felt like it was a case of bad mastitis, and I just felt like antibiotics were needed. So another 2 weeks go by, nope, still no change. So he gives another antibiotic, but at this time he tells me to combine two, so to take two at the same time. And obviously antibiotics are so harsh on your tummy and like your body, so I was just like, no. But what ended up happening was that in the meantime of the doctor just kind of saying just empty it, take your antibiotics, I developed an abscess, but I didn't know it was an abscess. Went back to the doctor for a third time, and at this stage like there was like kind of like a lump in my breast, and he said to me, look, to be honest, usually in this situation I would be sending you to St. Vincent's Breast Clinic, and they would do a drainage procedure, not like where you're put asleep, just kind of like with local anesthetic, where you get a drainage procedure performed, and it would help flush out like the mastitis, and if there was an infection. But because of lockdown, hospitals wouldn't take me. They weren't taking anyone, and they were only treating cancer patients. So he said, just keep on taking the antibiotics and go to the emergency room if you need to. And I was like it was insane to me. But only now when I think back to it do I really fully comprehend like how fucked up like it really was. So at this stage it was painful for me to like pick my baby up. It was hard to hold Eli, so I completely stopped breastfeeding. What ended up happening was my milk was no longer coming out, but it was there. So my whole breast swelled up. It turned blue, black. It was so bruised internally that the abscess had gotten so big inside. It was like, if you can imagine, you know, like a soap block, like a block of soap. That's how I felt, like there was a lump in my breast. And I was like so panicked by this. And I was like, the antibiotic isn't working. They're not letting me go to a hospital. Like, what am I going to do? So, yeah, I ended up just getting really dizzy. Like, I fainted, I'm pretty sure, at one stage. Was close to fainting, like, regularly. I could feel like the infection or the abscess was taking over my whole body. But as I said, at the time, we did not know it was an abscess. We still just kept on thinking it was a bad case of mastitis, which is what the doctor had said. So my mom seen me just deteriorating, like completely deteriorating. When I tell you I would do labor 20 times over, and both of my labors were unmedicated natural, I would do labor 20 times over than to go through that pain that I went through. I am not exaggerating. Like, it was, at the time I actually thought I was going to die. Like, I remember crying, being like I am going to die, like someone needs to help me. So she ended up taking pictures of my breast. She got in contact with a nurse in Vincent's and convinced her to show the pictures to the head surgeon. So skip ahead anyway, a few more like days and weeks of hounding like the people who are supposed to help you, hounding these people whose their job is to help you when you are like physically in need of it. But we're not allowed due to lockdown. And like, my story is one of the millions of stories that there are where people did not get the help and the care that they needed, whether it have been physical, whether it have been mental, that they were completely neglected, and in some situations died due to this, like literally died due to this negligence, and who have deeply suffered from it, and who have now some life altering changes that would have happened from sickness that they experienced that wasn't addressed and wasn't helped on time, and like that's something that they have to live with now. So yeah, this video isn't about, I suppose, that, but like I just kind of wanted to like shine a light on that and to like point out that I wouldn't have had to have the surgery if this nonsense of not allowing patients go to hospitals when they needed to wasn't in place. So yeah, let me really stress that, because had I have gone sooner, like the doctor had said, that usually what would have happened is I would have been sent sooner to a hospital. He used to ring the hospital. Now bear in mind, he was trying. He rang the hospital was like not answering, or else saying like no. But I think because my mom had sent the pictures to the nurse, the head surgeon seen the pictures of my breast and said, get her here immediately. And thank God my mom was like, no, fuck that. Like, we're not listening to this anymore. She needs to be seen by someone. Like, my mom was like, she's going to die. Like, you need to see her now. My mom was so afraid I was going to get sepsis. And it turns out that I was starting to get sepsis, and I would have got sepsis, and it could have been a lot worse if the sepsis had spread, because if that abscess had ever erupted or burst at any stage, like, that would have been me completely fucked. So, and like, I talk about this now, like, without too much emotion, but like, I will talk about it a little bit after when I finish the story, but like, it was so traumatizing. So I go to the hospital, I go to St. Vincent's Hospital straight away. They do a incision there and then and do a drainage procedure. He sees how bad it is and says to me, you actually need to go for surgery. We were going to have to go in and like remove part of the breast tissue. The abscess is so deep. So him doing the drainage there and then, it was like too late. It had gone in too deep into me. So they were like, we need to do a proper surgery. Bear in mind, my other breast also had to have a drainage procedure, but luckily didn't have to have like tissue removal. So they end up removing the tissue that the abscess would have affected. Again, it was during the lockdown. For that thing that they refer to as a pandemic. Yeah, a pandemic of people who weren't able to access healthcare when they needed to. A pandemic of people who weren't able to access mental health support when they needed to. A pandemic of children not able to go to school, not able to play with their friends. Yeah, we'll talk about pandemic. But anyway. So during that time period, I wasn't able to have visitors. Now, my baby was 3 months old, nearly 4 months old. I had to stay in hospital for 4 days. So I was separated from my baby, couldn't see him, had just had surgery, was alone. I've never had a surgery before. I've never been put to sleep. That in itself was like terrifying. And I was also terrified because I was so mistrusting, because nobody was helping me. So I just was so scared of like trusting people. I was just like, this is it. Like, I was fully convinced something was going to go wrong in the surgery, wasn't going to wake up, some bullshit was going to occur. So come out of surgery, agony, absolute agony. Had to have bandages all around my body, had to stay in the hospital for 4 days. Then I got discharged. But this is also where the whole lack of healthcare, and people will say, oh, you know, the hospitals obviously were overrun and they had to like only take priority cases. The hospital was a ghost town. When I tell you it was a ghost town, it was a ghost town. And terrifying people to the stage where they're not going and getting the care that they needed to get, that they were so afraid of like going to the hospitals. They were so afraid of going to ER in case they caught. So, yeah, anyway, so the hospital, that obviously nobody, there was literally no patients there. Rooms upon rooms. They gave me like a massive private room. I did not have the health insurance that covered that, but it was open, it was available, they gave it to me. So I get discharged. So usually when you have a abscess removal and tissue that's been affected, removal from your breast, you have to leave the wound open and you pack it with gauze every day and change it, right? And usually you would be considered an outpatient, so you would go to Vincent's where they do this, and that is painful. So sometimes they offer you a local anesthetic, saying that I probably wouldn't have accepted it even if I was an outpatient, but they do give you it. So I get discharged, and then luckily I was staying at my mom during all this recovery time. They said she is not going to be able to come back and forth as an outpatient. So they taught my mom how to do the procedure of unpacking the hollow. It was like a hollow hole nearly that had to like heal from the inside out. Um, so she had to be the one to literally change the dressing every day, to take the gauze out, to like let it drain, to clean it, everything. And the pain, like I would be like lifting off the bed, and it got to the stage where she was doing it one stage, she took it out and I passed out, like I blacked out, completely blacked out, was conked out, fainted. The pain was so bad. So that went on, and this is not a joke, for nearly 3 months, because it takes that long for it to fully heal, for it to fully close, or sorry, 2 months to fully heal, to fully close. So she was doing this for the first while, every like day, and then it would like spread for like every 3 days. You'd have to keep it dry or whatever in between. So that obviously was horrendous for me, but also really, really scary for my mom, because she was like responsible for like my recovery and like doing it correctly. And obviously she would have felt pressure because she wouldn't have wanted to do it wrong and for me to like get worse or for something to happen. So she had to do that. Yeah, she had to do that. She had to do that. There was nurses, there was doctors, there were people in these clinics, but they were not doing it because everything was shut down. In breast clinics, so obviously they specialize with dealing with people with like breast issues. So yeah, I came on, I suppose, I wanted to tell the story. I wanted to purely stress that if you know something isn't right, and if you feel like something isn't right, don't take drug pushing as a like just pawning you off. Take these antibiotics, take these antibiotics, take these antibiotics. Oh, we can't ring the surgery place for them to do the drainage. Like, don't accept that. If anyone is going to care for your health, if anyone is going to advocate for your health, for your life, like this was like something that could have been life threatening, it has to be you. Like, it has to be. People put so much trust into people who wear white coats, who have the word doctor in front of them. And honestly, I really don't know why. Like, human error is so easily done. And also, like, I suppose for me anyway, when that occurred, that was just kind of like the start of me becoming so questioning and mistrusting of people who work in the medical field. So yeah, but basically another thing I wanted to say is, when you are breastfeeding, I am completely aware everyone's experience is different, but after that all happened, I felt so upset at the fact that Eli was going to be on bottles and stuff like that, and I was just like overwhelming guilt. But like, all you can do at the end of the day is your best. Your baby needs you healthy, physically, mentally, and if you're not physically and mentally healthy, you know, that's the main priority. Because for you to be able to be a mom, for you to be able to show up, for you to be able to get up at night, for you to be able to just function, you have to be healthy physically and mentally. So that brings me to now with Nova. So when I was pregnant with Nova, I was hemming and hawing. I was like, I don't know what's going to happen now, because I don't know whether or not that boob is going to produce milk, if it's going to work, if I'm going to be able to breastfeed from this boob. I might only be able to do it with one boob, which I know some people have done before. So I was like, okay, well, all we can do is see what happens, but just don't put pressure on yourself. Just know that, like, either way, Nova is going to be okay. So of course you can have your preference, you can have like your want, but I just knew from that whole process, I was like, I am not going to let 1 ounce of stress consume me or take away from this experience that I have with Nova, because obviously it really affected my process of becoming a new mom with Eli. Like, this happened when I was 2 months postpartum. Then obviously the recovery period from when he was 3 months was another 2 months, whereby I had to have like an open wound. I couldn't hold him for a certain amount of time, like lift him up. I used to just sit with him. I couldn't like stand and hold him because it was open, and it used to bleed. It used to like leak when I'd be like lifting, and I'd feel pain like moving my arm over my head. So I said I'm not gonna like let the fixation of like breastfeeding or any of that affect, you know, the joy that I want to experience with Nova. And I'm so happy it hasn't, and I'm so happy and content with my decisions that I made around it. So when Nova was born, I tried to breastfeed her for her first week, basically. The breast that I had the surgery on completely just was not producing. It was only one boob that started producing, and I got mastitis. As soon as I got mastitis, panic mode came on. I said, oh my god, like I started panicking. Then I started being like, I only have one functioning boob, and it's the one that's now getting mastitis, that's like able to produce the milk. So I straight away like just stopped. I stopped because what was happening as well was that because she was only nursing from one, that supply like was like, there was so much as well. Again, the same with the same thing that had happened with Eli, where I was having like an oversupply, like an over. I'm not talking like, you know, I'm talking like I would feed her and I'd be able to like express a whole bottle like straight after, and probably more. So I stopped, and she has been on formula since 2 weeks old. And I know it was only a week, but I'm really happy that I got that in, and that I tried. Obviously what happened like was completely, what had happened with Eli is like completely out of my control, and how far it went and how severe it progressed was completely out of my control. But yeah, I just wanted to put this video up to stress to you that like when it comes to anything to do with your body, from a physical point of view, like you yourself are the one who lives in you. You know what's normal, what's not normal for you. And that's what was kind of tricky, because obviously I had never breastfed before. Eli was my first baby. So I was thinking maybe this is normal, like maybe it's meant to feel like this. And then as soon as like where it was no longer just my breast, where like, because obviously when you have an abscess, like it really affects your whole body, like you feel pain everywhere, like it was so severe. I was vomiting. I felt so violently ill. And sepsis is like really, really dangerous as well. So yeah, I wanted to talk about that. Eli is now 3 years old. I've never spoken about this at all. I've never I think as well, after having Nova, I was able to kind of process what happened with Eli, because I think when what happened with Eli occurred, I was so, you know, when you have this pressure, you nearly put a pressure on yourself as a mom, where you're like, you have to enjoy this. Like, not you have to enjoy this, obviously you enjoy it, but like, I didn't want anything to take away. So even though I was going through this trauma, not only mentally, but physically, even though I was going through that trauma of like the pain, I was like, no, like, my baby, I'm holding my baby, like I'm just pouring my love into my baby, and I was putting that on the back burner. And I feel like only kind of in the last year, like through my pregnancy with Nova, even after having Nova, I been able to fully process like what happened, because now I've been able to experience the postpartum in a different way with Nova. Well, obviously as well, I did a home birth, so I feel like that completely supports the postpartum in a completely different way as well. But I've been able to, I feel like what it should have felt like what it should have been, had that like horrible experience not have happened. So yeah, trust your intuition, trust your body, and don't accept no for an answer. Like, get second opinions, do your own research, like online as well. I had seen, don't let mastitis turn to an abscess. Do the drainage procedure. So when we had seen all this, we were like, we gotta get to Vincent's regardless. Like, my mom was like, we're either driving there or, but like, she was just like so adamant to be able to talk to a surgeon for them to see, because she was like if you could see what her breast actually looked like right now, like, you would probably be really shocked. So can we just at least give you photos so you can decide whether or not she can come? So as I said, once they seen the photos, they were like, get her here. But when we went there, this is what was scary as well. I presumed, because I had seen online, when you have an abscess, in my head I was mentally preparing myself for a drainage procedure whereby they do local anesthetic. Yeah, it's horribly painful, you're awake, and then it gets done. But for them to do that and then for them to say, well, actually you need to have emergency surgery, like, I just wasn't prepared. But I suppose emergency surgery, like, when are you going to be prepared for that? But yeah, if there is any questions on the topic, feel free to ask. Or if anyone has had a similar experience, let me know. Like, I'd love to chat with you about it. And hopefully you are fully healed and yeah, in a better place. I know it can be really, really hard, and if you have gone through it, you are here now and you made it. But yeah, when you're in it, it just feels like a blur. And like, when I think of my poor mom, like, the pressure she would have felt, and like, knowing when she's doing it, I'm in so much pain and I'm fainting, and she knows she's the one doing it and she has to keep on doing it until it's healed, which is 2 months. Like, it definitely affected her as well. Like, it affected her negatively completely. But yeah, that's, as I said, I'm one in a million, if not more, of people who didn't get to access the care they needed and were left to those type of situations. But that's why I will scream from the rooftops. I don't care who you are. I don't care what degree you have. I don't care how much experience you have. You need to listen to me. You need to fully hear me. You need to respect me. And you need to, if your profession is to help people, if your profession is to even just from like a moral point of view, like, I just don't know how any of that nonsense happened. But yeah, this video, as I said, is not going to be about that. If you want me to do a video where I'm ranting about that, I could do it for days. Literally just leave in the comment section scamdemic and I'll be here for days. But yeah, so I don't even know what I'm going to like title this video. Abscess. Yeah. Okay, guys, so until next time, I will leave you guys, and I will, hopefully you guys will leave comments, because I'd love to hear like your experiences when it comes to breastfeeding. And like, even like, if you've had amazing experiences, like, you should be so proud of that, because breastfeeding in itself is like, even though with Eli only was able to do it for those 2.5 months, like, it's a full-time job, and you're like literally burning all of your energy whilst having to like maintain everything else in life. Like, women are just next level. Like, every single day I'm just like in awe of what the female body can do and what mothers can do for their babies. But yeah, I'm gonna end this video now and go home and give my baby a big kiss.